My name is Dr. Frank North. I'm an instructional assistant professor at the Mallermer College of Pharmacy at Texas A&M University. Pain relief is not one size fits all. Oftentimes when we walk into a pharmacy, we see dozens of pain relief medications, from oral gels for tooth pain to ointments, creams, capsules, liquid gels, tablets. And it's very important to know that the problem is not picking the product, it's selecting the best one to treat your pain. There are three common pain relievers that most people should know about. They are acetaminophen, also known as by the brand name Tylenol, ibuprofen, also known as Advil or Motrin, or naproxen, which is commonly the generic name for Aleve. Commonly, our acetaminophen is a part of a class commonly known as analgesics. Analgesics work to reduce pain and to reduce fever. That is different than our NSAIDs, or our nonsteroidal anti-inflammatory drugs that that commonly reduces swelling or inflammation that then treats the pain or reduces pain. So OTC, often people think that just because you can pick it up from the counter means that there's no risk associated with it. Oftentimes our over-the-counter products are medications that if used appropriately and safely, then they could be used for self-care, which means not under the supervision of a physician. So when we're taking these OTC products, it's important for us to know, one, whether or not we're taking an analgesic like acetaminophen or Tylenol, or if we're taking NSAIDs such as ibuprofen or naproxen. If we're taking naproxen or ibuprofen, we want to make sure that we take it with food, because there are some short-term side effects that can occur in terms of GI upset or increased bleeding in the stomach. And we want to make sure that we look for things like blood in the stool or increased bleeding when we take these medications. So long-term risk in terms of using pain relievers can be things like kidney disease or cardiovascular issues, which means complications of the heart when we take them, and or a liver toxicity if we're taking things like our acetaminophen over the not to exceed daily amount. Oftentimes they can be taken together depending on what we're treating. So if the pain, again, is from inflammation or source or something that's swollen, then we can take an NSAID. But if we feel like that swelling is not going down fast enough and there's pain that's associated with it, then we can take the acetaminophen with it as well. Or we can alternate. So we can take them together, and we want to be mindful of the amount that we're taking and what the pain level is that we're trying to treat. And we want to make sure that if there's an opportunity for us to alternate, so we take one, let it get in the bloodstream, do its job. And then if we still have some mild pain or some breakthrough pain, then we can decide to alternate with the other. And so oftentimes wherever you can purchase these medications, there's usually a personnel behind the counter. One of those personnel is a pharmacist alongside many pharmacy technicians. The pharmacist is a very accessible, knowledgeable individual that has the capacity to talk to individuals about the pain that they're experiencing, to see which of the pain medications is most appropriate. So there's value in talking to the pharmacist and getting access to the right medication that's going to do the right job at the right time and the right dose for the patient. If you're treating a migraine headache, there are alternative products on the market that have caffeine in them. So caffeine has been shown to also reduce some pain, particularly headaches and migraines. So you see caffeine in products like Excedrin, and there's an Excedrin migraine. So there's an off-brand or a generic brand of that as well that's going to contain caffeine. Another alternative, specifically thinking about headaches as pain and migraines, being able to identify what's triggering the migraine or what's triggering the headache is important, because if you can mitigate that or reduce your access or your vulnerability to those particular triggers, then you can reduce or not have the headaches or the migraines. Pharmacists are medication experts. We're often the most accessible healthcare professional that a patient can see without an appointment. The pharmacist, we have the ability to help you determine what medication is most appropriate based off of age, source of pain, severity of pain, and whether or not you want to take something again by mouth, which is what we talked about most commonly, the acetaminophen, ibuprofen, and naproxen, but whether or not you want to take something topically. So if you want to rub something on the skin to give pain relief, a pharmacist has the ability to help you make those determinations. So over-the-counter prescriptions have helped millions get access to care and alleviate certain severities, in most cases like pain. So taking the medication appropriately, understanding the risk associated with it, and having a conversation with not just your physician or your healthcare provider, but the pharmacist has the ability to help you make a best determination for the medication that you're choosing over the counter.